Moving on, Claire, belief 8, lockdowns saved lives.
Right. Now, this one, I think, is so obvious now that, I just, because
It's
there
unbelievable.
was a
Yeah.
point in time where I could tell you that the maths of the wave said that it was over for that variant. But people are not that, mathematically literate, and they wouldn't know how to question that. And they say, well, that's not what I'm hearing elsewhere, Claire, so I'm not going to believe you. But all I need to say now is, look at all of these waves all over the world that are always the same period of time. And now try and persuade me that the lockdown saved any lives. It's as simple as that. The longer that time goes on, the simpler the argument has become.
It really is
And
an easy one, yeah.
yeah. But nevertheless, people still believe it. And some people are still arguing that we should be going back into one now. I mean, thankfully, they're not getting in the airtime that they were getting before. But
Thankfully, yeah. I mean, I remember back in 2020, the World Health Organization, I think it was about March, fairly early, saying containment is possible. They actually believe that this could be the genie could be put back in the bottle somehow. I mean, just
it was always madness. It really, really was. And actually, one doctor described it quite well to me. He said, if you imagine a bath of water and you drop some food colouring into it, and if you're really, really quick, you might be able to scoop it out with a cup. But if you're not that quick, then it's too late, isn't it, Zebra?
and of course we do this every time we do a lesson on diffusion for the students, don't we? We get a beaker of water and we put in a drop of ink, and it goes everywhere. I mean, I think partly there was some internal consistency in the lockdown idea. If you accepted unequivocally, which of course we've now disproved, the close contact model, if that had been completely true, would lockdowns still have worked to an extent?
So that, I think, is a really, really interesting and important question, because, now that they've been done, right, now that lockdowns have been done, they have become a potential tool to be used in the future.
Yeah.
You have to say, right, we've got to sort of have that conversation about why they are always wrong, frankly. So they were always wrong from an ethical perspective and from a sort of Western democracy freedom perspective anyway. But just in terms of could they ever work, that's a separate question to the ethics. And in terms of could they ever work, I don't think they could. In that, if you've got, respiratory viruses are airborne. If you've got something that's airborne and spreading the way that influenza and SARS-CoV-2 spread, there really isn't anything you can do about them spreading. There really, really isn't. And that applies no matter how deadly they are. So the argument about, but it's so deadly, if what you're doing is going to have no impact, you don't do it, regardless of how deadly.
It's total irrelevance.
Yeah. So that's that side of the argument. The other side of the argument is, okay, what if we did have something that did only spread close contact? And the example we've got for that would be gastroenteritis, where you've got fecal-oral transmission. So you have to have close contact for spread. So we can say, well, we've done the experiment now. We can see what happens to gastroenteritis. And we had a record of how many people turned up at the accident emergency department with gastroenteritis over the course of the lockdown. And it's absolute perfect correlation with mobility, right? So, you see as it falls off, as people stopped moving around, their mobile phone data shows that people were at home, then the number of people turning up drops. But it doesn't drop to zero. It kind of halves, right? So for the period of lockdown, you can slow the transmission of a fecal-oral virus to about half of what it otherwise would be, which means that you're not preventing a wave, but you could slow a wave. So then,
delay it, kick it down the road a little way.
Well, I mean, it would still be going on because you've still got half the spread.
Oh, I see. Yeah.
Still, you can't. It's not zero. It's half the spread, so it's slower. And the thing is then that the models of close contact transmission suggest it would take 14 weeks to reach a peak as it got into every corner of the rural parts of the country, and then it would peak and decline. So if you've got something that's going to take you 14 weeks to peak and then 14 weeks to decline, so you're already in, 6 month territory, how much slower do you want it to be? because I don't want it to be any slower than that and to destroy the economy for something that's inevitable because it's passing through anyway.
Yeah, you can't stop it. You can just, yeah.
Yeah, so you don't want to lock down for a year to slow something that would have taken 6 months so that it takes 12 months. That's completely mad. So actually, even at both extremes, there isn't an argument for doing it. Doesn't.
And there's a human arrogance here as well, isn't there? We can conquer nature. We can control nature. We can control. It's just the arrogance is absurd.
I think what's almost more absurd is the people who were pretending they could do that are still in positions of power and still being looked up to. That's the absurd bit. Everybody can see that they've been kind of canutes of the age, and yet they're not embarrassed and they're not stepping down. They're not resigning. Like, that's the problem.
They're still there, blagging it.
Yeah.
Pretending he all was good. And of course, Canute knew he couldn't stop the waves.
No, I know.
He was actually showing how fallible he was. So maybe some politicians who are watching, and I know lots of politicians do watch, if they could learn something from Canute, that might be a good idea. If we don't learn from the mistakes of history, maybe we're destined to repeat them. I mean, we've got other things we could talk about here, Claire. Sweden, Great Barrington Declaration. Maybe just a few words on those two.
So Sweden, I think, was really, really important country because partly because they were the control group, but partly because they defied what was going on everywhere else. I mean, that's hard. It's hard to do that. And Agnes Tegnell, who was the guy who made that happen, really deserves all the praise he gets for that. Really, really does. And it's been interesting how over time, as it became quite clear that Sweden were doing really well, that people started to claim they hadn't had a proper lockdown, that they had lockdown, people had done it voluntarily, that those kinds of arguments. And it's just not true. People went to visit and they had all this video footage of people out in the shops, in the cafes, in the restaurants, enjoying life in a normal way. And, the idea, the sort of lie that they sort of had a pseudo lockdown is just a lie. They didn't. And the virus passed through there as it passed through everywhere else. And it peaked and declined as it did everywhere else. I think Sweden is a really, really important case. And it's interesting with Sweden now that people are pointing to it as the exception regarding excess deaths. And I think there's three reasons why they're an exception regarding excess deaths. And one of them is because they didn't lock down, right? So if you are psychologically stressed, there's very, very strong evidence base that increases your risk of heart disease. And we saw in the UK young people having excess mortality in autumn 2020, non-COVID excess mortality from autumn 2020, that I think was related potentially to that psychological stress and all of the fear that people went through, that the Swedes did not get put through. And then the Swedes actually have a very low baseline cardiac mortality, which people confuse because they look at the overall figure and say, well, it looks about the same. But if you break it down, the people who are dying of heart disease in Sweden are predominantly over 80. And they don't have the sort of younger deaths that we have. And obviously you have to die of something. So we can't get overly excited about dying over 80 of something.
So the excess deaths in Sweden now, are they higher or lower or what?
Well, they've still got some excess, but they're the sort of lowest. And
lowest range,
can sort of age standardise it and make it look like it's not particularly much problem. So Sweden have, I think, through a synergistic thing with those different factors all playing a role, they've come out the best.
I mean, I think there was in the very, very early days, there was some panic in Sweden where people from care homes weren't admitted to hospitals. That resulted in in the very early stages where I understand end of life drugs were used. When we might not choose to, but I think that was very short lived. I think they got on top of that panic really quite quickly, and then it made a lot more sense. And just briefly, the Great Barrington Declaration, Claire, what was that about?
So the Great Barrington Declaration, I think, what they were trying to do there is really laudable, and they were coming from the place of close contact transmission is the be all and end all, but making the argument that actually that doesn't mean that you you can actually protect people who are most vulnerable by putting measures in place for them without closing down society. And so I think as a compromise position, it was a really, really important proposal. But I'm not sure that it really would have made a difference. I think you didn't need to do that because it was going to spread anyway. And one person, based on that close contact argument, made a really interesting argument, which is that if the virus is going to spread the way that we were told, so everyone's susceptible, it's going to work its way through the population, then what you want to do is you want to have the people who are youngest and have the strongest immune system on the front line, spreading it to each other and getting to herd immunity as quickly as possible, while you've got your frail and your elderly as far away from that contact as possible. But what you do by putting everyone at home is you are making everybody frail and elderly. And then you haven't got that hierarchy anymore. Everybody's going to be exposed at the same rate on the same journey towards herd immunity. And I think that is such an important point that never got made, even though it's not close contact transmission. Like, the fact is that was the mindset people were in, and they weren't hearing these important arguments.
So, top 3 myths. Reducing contact would reduce spread. Myth. Viral waves only peak with a change in human behaviour. Definitely myth. Predicted death estimates modelled on extreme assumptions were realistic. Predictable death estimates modelled on extreme assumptions were realistic. Yeah. What does that one mean, Claire? Sorry, I haven't quite got that one.
So it's just saying the modelling was wrong, right? This kind of crazy 500,000 figure that we were told is just plain wrong.
Yeah.